would cover it, even though RK is using it for smoking cessation. Which action best reflects honesty, veracity, while fulfilling professional obligations? A. Inform the insurance company that the prescription is for smoking cessation. B. Fax the physician stating the prescription cannot be filled. C. Contact the physician to discuss alternative smoking cessation options covered by insurance. D. Process the prescription as written so RK can start therapy. Answer. C. Explanation. Pharmacists must act truthfully. Processing as written is misleading. Informing insurance directly breaches confidentiality. The best option is to communicate with the prescriber about alternatives. According to Health Canada, what must pharmacists record when documenting a vaccination? A. Patient's date of birth. B. Complete medication list. C. Any adverse effects after immunization. D. Allergies to medications. Answer. Explanation. Vaccine documentation includes the date, vaccine lot number, site, dose, and any adverse reactions. Allergies are important to check beforehand, but the record specifically requires post-vaccination effects. Q8 situation represents the most significant conflict of interest for a pharmacist. A. Accepting free sample training devices from a drug rep. B. Sharing profits with physicians who refer patients. C. Returning expired products to the manufacturer. Attending an industry-sponsored educational session with free refreshments. Answer B. Explanation. Financial relationships with prescribers undermine objectivity and are a major ethical violation. The other scenarios are minor or acceptable with transparency. Competent Care Q9. JQ, a 67-year-old diabetic on insulin, has a blood glucose of 2.8 millimolar and appears confused. His wife calls for advice. What should the pharmacist instruct? A. Take JQ to the emergency department immediately. B. Give JQ a full meal rich in carbohydrates and retest in 1 hour. C. Administer 15 to 20 gram glucose and retest in 15 minutes. D. Retest in 1 hour and call back if still low. Answer C. Explanation. This is symptomatic hypoglycemia. First-line management is giving 15 to 20 grams of fast-acting glucose and rechecking in 15 minutes. Rule of 15. Q10. RF, an 80-year develops severe C, difficile infection after ciprofloxacin. She has diarrhea, fever, abdominal pain, and confusion. Which is the best treatment? A. Oral phytoxamicin. B. Oral metronidazole plus IV vancomycin. C. Oral cholestyramine. D. Oral vancomycin plus IV metronidazole. Answer A. Explanation. Phytoxamicin or vancomycin orally is preferred for severe CDI. IV metronidazole is only used if ill use prevents oral therapy. Q11. A patient with a red eye, a discharge asks about self-treating with polysporin, polymyxin B gramicidin eye drops. What should the pharmacist advise? A. Cover the eye with a patch. B. Instill the drops at least 4 times daily. C. Continue treatment for 5 days beyond resolution. D. Seek medical care if no improvement within 24 hours. Answer B. Explanation. Bacterial conjunctivitis can be treated with topical antibiotics dosed multiple times daily. Eye patching is contraindicated and extended therapy isn't required. Referral is needed only if symptoms worsen or persist. Q12. JG is on metoclopramide 10 milligrams Q6H chemotherapy but missed her morning dose. She'll be home by 11 a.m. and asks what to do. What is the best advice? A. Take the missed dose when she gets home and continue the schedule. B. Double the dose at lunch. C. Skip the missed dose and continue with the next scheduled one. D. Redistribute 4 doses evenly for the remainder of the day. Answer C. Explanation. For a missed dose close to the next scheduled dose, skipping it avoids overdose. Doubling or rescheduling incorrectly increases risk of adverse effects. Q13. EK, a 25-year-old, requests Plan B after untercourse 12 hours ago. What is an important counseling point? A. Take 1 tablet daily for 3 days. B. Do a pregnancy test 5 days after taking it. C. Plan B protects her until the next menstrual cycle. D. She may notice light spotting a few days later. Answer. D. Explanation. Levonorgestrel is taken as a single dose. Spotting is a common side effect. It does not provide ongoing contraception. Q14. FP, a 68-year-old with metastatic breast cancer, depression, and insomnia, says she only wants drugs that improve quality of life, not life-prolonging therapy. Which of her meds should be discontinued? A. ASA 81 milligrams daily. B. Gabapentin 300 milligrams TID. C. Duloxetine 60 milligrams daily. D. Lorazepam 1 milligrams HSPRN. Answer. A. Explanation. ASA for stroke prevention is life-prolonging, not symptom-relieving. The others target pain, anxiety, or sleep, aligned with palliative goals. Q15. Which of the following indicates poor asthma control